Joining me is Pulash Mukherjee, who's an expert in air quality and air pollution. Pulash, just want to understand from you that smoke towers were installed in Delhi after a Supreme Court ruling. But have they been effective in bringing down Delhi's air quality index or reducing the pollution or particulate matter at all?
No, they haven't. But the clear answer, short answer is no, they haven't, and they're not very effective solutions to begin with. The Delhi government insisted, in fact, the Delhi government, the NERI and CTCB insisted that they were being piloted to test their efficacy for controlling air pollution. But there has been opposition from technical experts as well as from academicians against the very principle of having outdoor air purifiers. Right, outdoor air purifiers are essentially have been in the past likened to installing AC outdoors on a particularly hot day to cool
Hmm.
the atmosphere. So it's not a very effective solution. The sheer quantum of air that needs to be purified means that there will have to be. There was one estimate that I believe CEW was involved in that estimated that around 40,000 such outdoor purifiers would be required to make any measurable impact.
Hmm.
Uh, so
So,
in short,
Palash, yeah. So it was essentially done after a Supreme Court ruling made it possible. So the Delhi government is also saying it's on experimental basis. But where will this experiment lead to? Because of what we've heard, there is a report being made by the IIT Bombay as well on this. And the purification of air doesn't happen beyond 300 meters of the installed smoke tower.
right. So I think the Supreme Court order, I think I'd rather not comment on what the thought process was behind that order, but it's very clear that it hasn't made an effect on the ambient air quality as far as the ambient air quality is concerned. I think what Delhi government was also referring to was the impact on the immediate vicinity, what you mentioned, the 300 square meter area immediately surrounding the smoke tower. There, it would
Mhm.
have limited impact for a very limited amount of time, as long as the tower was functioning continuously, and even this would be provided the weather, the meteorological conditions and weather conditions were favorable. So my view on this matter is that the, the amount of effort and the amount of resources put into this can be directed and should be directed towards controlling pollution at the source. We know broadly what the sources of pollution are in Delhi. They come from transport sources, they come from industrial emissions, they come from crop residue burning, they come from industrial emissions again. So these are the focus areas where these kind of resources, time, and effort should be put in.
Hmm. What about the experimentation with smoke towers that happened in China? You would be aware that even in China they had erected these smoke towers. Were they working there? Was the Chinese government able to reduce pollution in Beijing? And what can we learn from their experimentation there?
Look, so in China, air pollution was tackled at a war on a war footing. So there were several measures that were going on simultaneously, and therefore to attribute success to any one measure is not correct in my opinion.
Okay.
Smoke towers were definitely something that was tried out in China, and there again the logic was similar to have reduction of particulate matter concentrations in the immediate vicinity of smoke towers. However, these were accompanied with drastic and major reduction in emissions at the source, starting with industrial emissions. For Beijing, for instance, around the 2008 Olympics, uh, there were industries that were given annual quotas for emission, which meant that if they met the quota, no matter what time of the year it was, if it was June or if it was September or if it was even April, they would not get to function for the rest of the year. Now, this is a kind of measure, regulatory measure that they did bring into impact to show the kind of effects on air pollution that they have. Similarly, there were other
mm,
measures that were much more stringent in terms of vehicular emissions. There is a licensing regime in China that means that you could have the means to buy a car, but you could still have to wait as long as 5 to 10 years to get a car. So
mm,
let's not look at China. I think what is very important here in this stage
mm,
is to talk about health measures, as to talk about what and at an individual level and at a societal level what we should do to preserve health against the sheer heights of air pollution that we are seeing right now. This year, what we've seen through the Grid Response Action Plan is that for the first time it has been based on a forecast mechanism rather than waiting for the levels to reach there and then implement the
mhm.
Grid Response Action Plan.
Right.
This forecast can also be tied into health-based advisories and can be specifically targeted to vulnerable individuals.
Mm,
The elderly, children, individuals who are already susceptible to pulmonary conditions, asthma, COPD, and so on. So, for those particular individuals and classes of vulnerable sections of population, what are the measures we're bringing in there, and what uh, can be the strategic health risk communication which can prevent exposure for them is what we need to look at.
mm. But that exposure is already happening. In fact, people across the Delhi NCR are coughing. I have a very bad throat even as I speak with you. And it seems to persist over a number of days because the congestion just doesn't go. So, what kind of health advisories would you suggest should be implemented at the moment?
So one thing is to avoid exposure as much as possible. If your job permits you to work remotely, and by remotely, I am the assumption being that indoors is has better air quality than outdoors, given that the sources are all outdoors. Uh,
Hmm.
the other uh, the other assumption here is that you have access to air purifying equipment on a indoor setting, and you have access to masks, which can't be said for the entire population. So, given these conditions, those kind of advisories make a lot of sense. And given the condition that everybody does not have access to this, I think efforts should be made on that basis. Like, for instance, right now, I just read in the papers today that the Delhi government has announced a one-time compensation for workers for banning construction.
Yes.
While it is a welcome
Yes, they
measure,
have.
while it is a welcome
Hmm.
measure, what would be much more useful in the long run is to ensure that workers have access to personal protective equipment on a systemic basis, right? When you
Okay.
talk about
Hmm.
construction workers in India, very often on paper there are these tick marks that say that they have access to masks and hard hats and so on. But if you look at longitudinal studies, they have shown that over a period of workers' lifespan, they lose a lot of productive life to exposure to air pollution. They lose out
Hmm.
on they lose out on
Yes.
income, and they also have added medical
Yes.
expense owing to these
Yes.
pulmonary illnesses. Yeah.
It's similar to what when we talk about a class of people who are made to clean sewer drains, which should not be allowed, and machines should be used to clear out sewer drains. It's similar to that. I also just want to ask you that there are several studies, Polar, that have now said that pollution directly affects organs of the body. And what is the credence to these studies, and how scared one must be for their health and the health of their organs currently in Delhi NCR?
Look, so we are still trying to understand accurately what the impacts of long-term air pollution on the human physiology are. And in the past years, there have been various studies that have been linking it to various parts of the body, as well as to
Mm-hmm.
development in the womb, to pregnant children, pregnant by women and
Yeah.
unborn children, as well as to
Mm.
mental growth. So these are all evidences that have begun to be generated in India, but that mainly come from uh, the West. So we need to augment our research in this area much more. And at the
Mm.
same time, we don't need to ignore this data because it's not from India. We need
Mm.
to, make sure that this severity is reflected in the policies that we make. in our governance structures. I was just talking to a colleague about the annual number of deaths from air pollution.
Yes.
We lose about 16, 17 lakh individuals every year to air pollution here in India.
Hmm.
Uh, and
Very big
compared to
number
that, yeah, and compared to that, we lost about 500,000 in 5 lakh in COVID.
in COVID. That's right.
So
That's right.
three times the number of people we lost in COVID, we are losing every year to air pollution.
Hmm.
So if that doesn't reflect the gravitas of the situation, then we should be looking into
Hmm.
why that is.
No, definitely. And as we've been speaking, air pollution needs to be an issue of concern because it's not just pollution around you now, it's affecting your health, it's affecting your lungs, it's affecting your eyes, it's affecting your overall growth as well as the fetus in the womb of an unborn child and of the mother. So that is very important to understand. But thank you so much, Pulash, for bringing to light the ineffectiveness of smog towers that have been installed in Delhi by the Delhi government. Thank you.
Thank you, Mira.